My asthma symptoms are tight chest,
unable to get a breath of air in.
When I'm sick, I don't get better that easily.
Stuffy head, stuffy nose.
congestion.
So it's sometimes like,
It's basically made it very, very difficult for me to exercise. Skiing, snowshoeing, riding my bike, things like that were extremely difficult.
Feels just like there's weight or somebody sitting on your chest and you're trying to breathe and you're unable to take the deep breath and exhale the air that you need so you can be comfortable again.
In its most basic form, asthma is inflammation of the airways.
If I was around cats or dust or any kind of dander, that sort of thing, I would become very tight-chested and basically could not get a breath in, get a breath out. It was just very, very, very difficult for me to breathe.
We can think of allergies and asthma almost like a gang that likes to hang out together. There's this whole concept of one airway. So inflammation in your nose, inflammation in your sinuses leads to inflammation in your chest. Asthma is diagnosed typically with what we call the clinical history. So a patient comes in and sees me in the office and will describe a lot of the stuff that we've already talked about. Shortness of breath, chest tightness with exercise, or with colds or a cough that lasts for a long time. And then we'll do a test called a spirometry, which is a breathing test. Some people call it a pulmonary function test, where we look and see what their lung function is. That's where they will ask you to take a deep breath in and blow out as hard as you can for about 6 seconds. We ask you to blow out candles on the computer. But these days we have inhaled steroids and inhaled medicines that make a huge difference. One of the main reasons to see your doctor on a regular basis for your asthma is because asthma medicines do require technique, so that you have to take a deep breath in over 5 seconds, hold it for a count of 10 seconds, and then exhale. So it's not a pill that you're just swallowing or chewing. These are inhaled medicines that work by getting actually to the place that they're supposed to get to.
The confidence is just about just doing what's necessary to take care of yourself every day. It's part of my daily routine that I'm using my inhalers. First thing in the morning, first thing before I go to bed.
Clinical research is extremely important. At Colorado Allergy and Asthma centers, we perform a lot of asthma trials. So inhaled steroids are very expensive. They're currently all branded, and there isn't a lot of options out there that are more affordable. So the clinical trials that we're involved in look at generic options for these inhaled steroids that are currently on the market.
Working with the doctors and the nurses at Colorado Allergy and Asthma, it's pretty much seamless. You know, when we're doing a study, it becomes part of my day.
Wow, Colorado Allergy and Asthma has been a game changer for me as far as how I'm able to control my issues with asthma and issues with allergies.
They've opened my eyes to being proactive about my asthma.
they have made me feel better. They made my life more successful.
I can do day-to-day activities. We really, really enjoy our garden every summer. I mean, it's kind of the big thing to get going every year. And with the asthma under control, I can basically enjoy that more because I'm not having the breathing problems, I'm not having the stuffy head, I'm not having the nasal issues.
Can't control whether you have it or not, or whether it's going to come or it's going to go. The only thing you can do is be proactive about it and not let it hinder your lifestyle and what you want to do in life, period.